everyone. We're here today to learn about blood pressures. One of the first things you need to do with your patient is to make sure that they're seated comfortably and that their feet are flat on the floor. You want to make sure that their feet aren't crossed or that they're wearing high heels or anything like that. The next thing you need to do is to make sure that you have the correct size cuff. If you have a tiny patient, you want to go ahead and make sure you grab the extra small cuff, or vice versa, if you have a larger patient, you want to grab the extra large cuff. Most cuffs today have a little arrow on them to help you place it properly on the patient. How you do that is you want to find the brachial pulse on your patient, which you're going to find on the pinky side in the crease of the elbow. So you want to go ahead and feel for that. And when you find that, you're going to place that arrow right above that, about an inch above the elbow crease. And you want to make sure the cuff is on nice and snug. So you can just get 2 fingers underneath there. You don't want it too tight or too loose, so you just 2 fingers underneath it, you're good. Go ahead and place your dial so you can comfortably see it. And then your next step is you're going to need to find the maximal point of inflation. And how you do that is you're going to feel for the pulse, the radial pulse, on the wrist, on the thumb side. So you feel for the pulse, and when you do, go ahead and have your patient relax. You're going to go ahead and pump up your cuff. And you're going to feel that pulse as you're pumping it up. When you quit feeling it, you're going to go ahead and stop. And then, like Sarah's here, I felt it up to about 120. So when I take her blood pressure, I know I'm going to add about 20 to 30 millimeters of mercury on that when I fill up the blood pressure cuff. Your next step is you're going to go ahead and use your stethoscope, but you want to make sure that you properly place your stethoscope on your head. A lot of people that are new to this have a tendency to put the angle towards the back of their head. You want to make sure it's pointed towards the front of your head, down your ear canal, so you can hear it well. And another thing is some of these stethoscopes have an off and on. You can twist the bell. So when you go ahead and put your stethoscope on, just give it a tap. Make sure that you can hear through it. Alright, so we're going to place the bell over her artery. And like I said, we're going to pump it up between 140 and 150. And when I release it, I just want to make sure it goes down nice and slow, between 2 and 3 millimeters of mercury per second. And when I hear the first heartbeat, that's going to be the systolic number. That's the top number. And so for Sarah, I heard it about 116. And you just let it slowly drop. And when you hear the last heartbeat, that's going to be your bottom number, the diastolic number. But you want to go ahead and let it continue following about 10 millimeters of mercury below that, just to ensure that was the last heartbeat that you heard. And go ahead and release. Let your patient's arm relax. And you're going to go ahead and record your information. And how you do that is for Sarah, her blood pressure was 116 over 72. So how I'm going to record that is 116/72 millimeters of mercury. And you always want to ensure that you use even numbers. You never want to use odd numbers in your blood pressure. Another thing I need to record is what position she was in. So if she was lying down or standing or sitting. So for Sarah, I write down that she was sitting. And the last piece of information you need to record is which arm you took it on. So for Sarah, I took it on her left arm. So those are 3 pieces of information you need to record. So, and that's it for blood pressures. Thank you.